thank you all for coming. I know as I look outside today and I'm thinking, okay, it's gorgeous out there and we're inside on a Sunday afternoon, so I thank you all for coming. It means a lot. So let's jump in. For me, the impact of fear and anxiety on learning is something that is absolutely relevant just about every day when I'm working. So I run the animal behavior clinic, and we work with companion animals, primarily dogs and cats, but animals who have anxiety issues, aggression issues, compulsive disorder problems, you name it. Basically, we're seeing a lot of those patients. And anxiety is such a big part of, I should say fear and anxiety is such a big part of our clinical population of our animals. And so if we're going to attempt to change their behavior in any way, we're going to have to, at the very least, navigate that. We're going to have to figure out what that means for this particular patient. And so what we're trying to do is, well, with this particular presentation, incorporate as much information as we can about how you can also navigate that, whether it's for your own pet, whether it's for an animal that you're working with in the shelter, whether it's an animal that you are working with in any other capacity. These details are going to be relevant. So what is fear? If we're going to be talking about fear and anxiety and the impact on learning, it's really important that we're all on the same page. So fear, for my definition here, we're going to look at this one. A negative emotion elicited by a perceived threat. For the average patient that we're working with, it's something where we can identify it. If we have a dog, for example, who is afraid of something, what we usually see is their attention is either focused on the thing or they're actively avoiding the thing, whatever it is. But in most cases, we can identify whatever the thing is, whether it's an unfamiliar man, whether it's another dog, whether it's the trash can on Thursdays sitting out by the curb because it wasn't there yesterday, or whatever the thing is. It's something we can usually identify as a discrete stimulus. We can name it, and it's usually pretty easy to name for most of our patients. Now, something to keep in mind as we're talking about fear, and we'll talk about this a little bit with anxiety as well, is that it is normal. It's an adaptive response. It's appropriate for every single one of us, and including all of our animals that we work with, to experience fear in some way, shape, or form at some point in their life. It's one of the things that keeps us safe. Now, if that fear becomes the overarching motivation for everything that we do, or if it's creating other pathological problems because it's such a strong aversive emotional state, well, then we may be at a point where we are now non-adaptive. But at its core, it's a normal part of behavior. The specific response that an animal gives, this fearful dog, for example, may react very differently than this one. I'm never going to say that this is a universal response pattern. And the way an individual animal responds is largely determined not only on their sort of makeup and their personality, if you will, but also their individual experiences. If a dog has perceived a stimulus as fear-inducing, and they respond in a certain way, and then they feel better, for whatever reason, maybe they were able to avoid, maybe they were able to back that stimulus away, but in some way it worked for them, that's going to shape their behavioral patterns, and it's going to affect what they do the next time they're in a similar circumstance. So that individual nature of the fear response is very important when we're looking at individual animals. I'm not going to make blanket statements about how I expect an animal to respond. And some of the options that the animals may exhibit would be sort of the fight, flight, freezing, or fidget responses. And any of these are potentially appropriate for a fear-based response. Now, switching gears a little bit, if we're talking about anxiety, big difference here is rather than having this discrete stimulus that we're able to really put our finger on, we're able to identify it, we're able to name it, anxiety is more likely to be sort of an apprehensive anticipation of a threat. When we're talking about people, often the emotions of worry or dread may come into play, especially if people are able to voice what their concerns are. They're often not quite sure why they're uneasy, but they are. In animals, I don't know exactly what's going through their head necessarily. I can't get these words from any of my canine patients. I could make them up, but I can't. But we do see that in their behavior, it's very similar, this apprehensive anticipation of a threat. And this is also normal. So anxiety, the goal and the reason why anxiety is absolutely relevant is that if any one of us is in a circumstance where we are nervous or apprehensive, it keys up that emotional response system so that if something bad does happen, we're more able, more capable to respond in that moment. So we're going to have stronger startle responses. Our reaction times are likely to be quicker. We might have shorter fuses in terms of the responses that we actually give. But it's a normal process, that keying up of that emotional response. Now, why is anxiety there? Why would that be an issue for our patients or even for ourselves? A couple of the common patterns that we may see is if an animal has had some negative or unpleasant experiences, especially if those unpleasant circumstances are unpredictable. So bad things happen from time to time, but you don't know when, you don't know where, and you don't know why. Is that going to make anybody else in this room nervous? Yeah, it certainly does for me too. So if we think about our patients, if they are experiencing unpleasant things in unpredictable or unexpected ways, or if they're not able to have at least some degree of control over their surroundings, that's a common cause for anxiety. And that's a question I get a lot from my clients. Why is my dog so anxious? Well, it could be any one of these things. But this is what anxiety often looks like. I'm not going to go into this in a lot of detail. We're not going to go into a tremendous amount of anatomy and physiology and that, but I am going to point out the things that I think are really relevant for our discussion today. We're going to start out with the prefrontal cortex. So that's the front part of the brain. And that is the area of the brain, in thinking about brain function in somewhat simple, straightforward terms. This is where a lot of our sort of logic centers happen. That's where we reason. That's where we make active decisions. That's where we are processing a lot of our information. That's where all of that needs to happen. And that's where, truthfully, where a lot of learning happens, as well as a lot of those decisions that need to be made. This is relevant because if we are training an animal, wouldn't it be important if they were able to process and form concepts and regulate their emotional responses, perhaps? That's going to be really relevant. We're going to come back to this piece, this regulation of emotional responses. We're going to come back to that in just a little bit, so I'll skip over that for right now. But this is a really important part of the brain for us. It's where a lot of this happens. Now, in comparison to that, we have the limbic system. And this is a couple of different brain structures. I'm not going to go into the details of which ones are involved, but the limbic system is where a lot of the fight, flight, or anxiety emotions are generated. And that's really what drives a lot of that fight, flight. During those periods of danger or arousal, that system keys up, and that's what keeps us safe. That's where a lot of that information comes from that drives that hypothalamic pituitary adrenal axis that kicks out cortisol and adrenaline and norepinephrine and all of those things that we hear about on commercials for drug companies. And yeah, so that's where all of that sort of starts to kick off. So that's where it's relevant. And again, under normal conditions, necessary. It should be active at certain times. It's supposed to be there. Now, how are they related? Well, in some ways, this is how they're related, but what I'm really going to focus on here is the relationship between them. And when I'm talking with my clients, I often think about this almost like a teeter-totter. That we really can have a balance between the two. Now, if you think about that, even for yourself, if that balance is really heavy on the cognitive side, and we're rational, and we're making decisions, and we're talking about discrete things like 2 + 2 = 4. It's very straightforward. It requires very, very little emotion. And in fact, emotion may not really even play a role in that sort of brain processing. On the other hand, if we flip that teeter-totter in the other direction, and we're making decisions, and we're thinking about our life in very emotional terms, anybody else ever have those experiences? Where you're just sort of, just riding it, and you don't really feel like you have any control, and you're trying to make sense of it, and nothing makes sense. That's when we're here. And there should be a relationship and a balance between the two. That is going to come into play when we start talking a little bit later about actually navigating this fear and anxiety balance. But it's relevant to understand it's actually, at least partly, a physiologic response. It's supposed to work that way. when any one of us is in a moment where our body is telling us danger, 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 it's appropriate for the rest of our body to say, get yourself to safety. That's the only thing that really matters right now. And so 2 + 2 = 4 doesn't matter. The grocery list for Tuesday doesn't matter. Those sorts of things really become almost irrelevant until that emotional response system is able to come back to normal and find that balance again. So we find that for a lot of our patients, especially the ones that I see in my practice, we often refer to them as being in limbic overdrive. Or limbic override, Lots of different terms that you may see with this. Some people might call that red zone. Whatever we want to call it doesn't really matter what name we put on it. What we're really all talking about is we are in a predominant state of emotional arousal, and that prefrontal cortex is not particularly active at that point in time. Again, we'll come back to that as well as we talk about the impact of that on learning. What do you think? What's that going to do for us if we're working with an animal in any capacity and we have an animal who is in that heightened state? What effect might we anticipate that would have on that animal's ability to learn? Not going to focus, not going to be able to learn? Absolutely. And at the very least, the learning is going to be different. It's a different sort of learning that happens when we're in that frame of mind. Well, if we're going to talk about learning, what is that? We've talked about fear and anxiety. What is learning? Learning is a change in behavior based on past experiences. And something that's really relevant for all of us, as well as when we're working with animals, is that learning is constantly happening. We're constantly responding to the feedback that we get, whether it's from the person who's sitting next to us, whether it's from the way we're interacting with our environment. If we push the buttons back there and the room gets colder, we learn that the buttons in a certain sequence has an impact. We learn that if we show up to this particular room at a particular time, we're going to expect to hear certain information. It's all this feedback that we're getting from our environment, both social and physical. It's always happening, even if we're not actively teaching. And what I really mean by that is when I have my patients, especially those with fear and anxiety issues, they're constantly getting that feedback from their surroundings. And if I have clients, perhaps, who are not paying attention to what feedback they're giving, well, number one, the animal might be learning something different than what the owner would actually like for them to learn because they're not steering that. And that's actually probably one of the most important ones, is that if we are not actively teaching, we don't really have a whole lot of control over what the outcome might look like. So this interplay between the environment and social cues and all of that learning is really important. And quite honestly, whether we're talking about dogs or cats or horses or birds or people or salamanders or whatever we want to talk about, learning is learning. The basic principles are essentially the same. Now, that's not to say that every animal responds in the same patterns, but the basic premise of learning is very much the same. We've talked about this a lot already, but the environment that an animal is in is going to play a role. Now, whether we are in an environment like this, where there's a lot of sensory information, there's smells, and there's movement, and there's activity, and there's all sorts of things happening, or whether we have a dog's undivided attention and we're giving them something like a click as a form of feedback, something that's very precise, very specific, has a very intentional meaning. These are two very different conditions. And so the process of learning is likely to be a little bit different in each of those. Now, something that I want to introduce is this concept here. We're going to talk about this a little bit more on the next couple of slides. That the emotional state that the animal is in can absolutely impact the type of learning that's most likely to occur. Now, what I mean by that is if we have an animal in what I'm going to refer to as a negative emotional state of fear or anxiety, the number one motivator for most animals when they're operating in that emotional state, and by animals we can include ourselves, the number one thing that matters is safety. How do I get back to the point of feeling in control? How do I make the unpleasant things stop? That's what matters the most. And that creates a primary motivation of avoidance or escape as a significant influence. On the other hand, if we are in more of a positive emotional state, some might refer to that as more of an appetitive or a seeking type of a state. We have animals who are more motivated by eating, by play, by social contact. That is something that they may go out of their way to see how they can achieve that or how they can acquire that. It's a very different style of learning. It's a very different style or very different influence on the behavior patterns themselves. And what we find there is the types of things that happen is that if we're functioning here, avoiding danger is really relevant. Here, we're actually strengthening behavior patterns. Animals are seeking out specific patterns or, in some cases, coping strategies because of the emotional response that happens as a result of that. Does that distinction make sense? Any questions about that? No. Excellent. It's a really important point as we get into the sort of the heart of what we're talking about today. That if fear is present, safety is the thing that matters. And we're not going to get a dog that looks like this if fear and anxiety is a huge influence on them in that moment in time. So what does fear and anxiety look like? So, who wants to point out something that they see in one of these photos, or maybe in multiples of these photos, that we might attribute to fear or anxiety? Yes?
Well, the one on the left upper, his lips are gone back, showing the stress response.
Yep, exactly, and it's got that nice marking where we can see it in this one, even though the picture's a little bit on the fuzzy side. We got that laterally drawn or horizontally drawn commissure of the lips.
All of those pictures actually depict stress and anxiety in some form. The one in the middle, yawning.
What else do we have perhaps in this one? The lip licking. Anything else that you see in this particular photo other than the lip licking? The furrowed brow. Flattened ears. Yeah. Whoo! Yeah, and a lot of those things go together. We get that wide eye, which often creates facial tension, and the ears are pulled forward, and we get this whole, almost like this triangle that develops up here, and then we get the clincher down there with a little tongue flick or lip lick. Pupils are dilated there too. Yeah, there we go. Someone called out the whale eye there. I'm really curious what's over here. We often get that whale eye when the eyes are going this way. It's usually sort of a combination of avoidance, concern, and a beady eye. I'm not taking my eyes off of whatever that is over there, and we often get that white ring around that we call the whale eye. Why might I put this one in there if we're talking about what fear and anxiety might look like? Displacement behaviors is a great way to look at that. We can see a lot of things like fidgeting. We can see barking. Well, we can't see barking, but we can hear barking. We might see digging. We might see other displacement behaviors. For a lot of dogs, scratching is a displacement behavior. We see it a lot when we're working. If we put just a little bit too much training pressure on them, they check out for a second, fidget, start scratching, and then they might reconnect again. So displacement behaviors can take a lot of different forms, and that might be a reflection of fear or anxiety as well. And then certainly yawning. Here we get a little bit of that half-eyed, slanty eye as well that we often see where dogs look tired, even when they're perhaps not. They're well rested, but we get the change in the eye position there in several different ways. So it can look like a lot of different things. Now I put these up here too to start kind of contrasting the two. And one thing you'll notice on these two lists is that there's a lot of overlap. Fear and anxiety sometimes are difficult to tease out from one another, which is why for the purpose of our presentation today, I'm going to kind of lump them together a lot. They are different, as we talked about right at the beginning, whether it's a discrete stimulus or whether it's an apprehensive anticipation of a threat. They are different. And our treatment of them really does it matters. We treat them differently, whether we're dealing with fears or anxieties, but the impact on learning is a little bit more similar. So one thing I want to point out here, if we're trying to figure out which of these emotional states we're dealing with, if we're in a situation where it matters to determine that, again, we have that focus on or away from the stimulus. The reaction should stop when the stimulus goes away. If the stressor's there, animal is concerned, stressor leaves, we might see them soften their posture. They might give that big shake off and release that tension. We might see a full body stretch. We're going to see some sort of physical change, and they're back to normal, or they've improved at the very least. Versus anxiety, that's where we're more likely to see hypervigilance and scanning, and a loss of selective attention is a really relevant piece for us as well. We get animals who are very easily distracted and hard to focus. So, I want to talk just real briefly, as we're talking about the body language associated with fear and anxiety, all of those cues that I put into these photos here are there for a reason. They are there for a reason because the communication that an animal is expressing, well, there's a giver and a receiver, right? And so if we see those internal physiologic changes because of stress and anxiety, and if it's important for that animal to be able to exert some control or to have a conversation, if you will, with someone or something else in their environment, they're going to give those signals outwardly. So it's, well, our job as professionals and as pet owners to be able to see those signals, to know what they mean, and to be able to respond appropriately. In most cases, when we're dealing with fear or anxiety, a lot of the body language has an intention of appeasement or to diffuse. Again, it's all about safety. It's all about attaining some sense of control or predictability. And we can also use body language as our indication of threshold. Now, when I talk about threshold, there's a couple of specific things that will come to mind, and we'll cover that just a little bit here as we go through. Threshold is the point at which the change in behavior or the change in emotional state occurs. That threshold is going to be different for a lot of different people, and individual people are already getting nervous as we go through. Everybody's set point is a little bit different. Some people adapt. Some people become more sensitized. Same thing happens with our animals. If we are dealing with stimuli that are of different intensities, the effect that has matters. Now, depending on what sort of intensity we're working with, we may find that, well, we might be under threshold, in which case many of you, probably some of you, may not even really notice or care that that's even in the corner of the screen. It's there, but it's irrelevant. At some point, as that stimulus becomes a little bit more intense, it becomes a little bit more relevant, perhaps. And as we go over threshold, that's the point where, again, we start to really trigger that fear and anxiety. And we can often detect, and even as it's one of my favorite parts of this lecture, we watch for body language, don't we? So what I start to see is, even when I went here, I saw a couple of people go, ooh. And then, okay, nope, not going to see there. I'm just going to wait for him to finish this section. And we get all sorts of changes, so I can tell whether we're at, below, or under threshold based on the body language. So moving forward from all of that, I think there are no more spiders for those of you who I just freaked out a little bit. How is this relevant to dog training and learning that we're doing with, teaching that we're doing? How is this relevant? The impact on training might be relevant in terms of the animal's lack of attention. They may just not be paying attention. We may find that we're having to repeat things a lot in order to accomplish things that we thought they should be able to handle. They may have difficulty generalizing their skills or their emotional states. We may have that loss of selective attention or hypervigilance. We may see that it directly interferes with the communication that's happening between the animal and their handler, whether that's the owner, whether it's the veterinarian, whether it's a groomer, whether it's a dog walker. There's some interference that can happen. Now, that can look a couple of different ways. In some cases, if this is a dog who's really concerned about this particular individual, he might be saying, down, for example. They're not taking their eyes off, and they're not going to put themselves in a vulnerable position because of being worried or fearful. They may not be able to look away from the fear-inducing stimulus. And this is often relevant if we have, for example, a dog who is afraid of another dog on a walk. And the moment that other dog shows up, boom, that's where the eyes are. And we're saying, Sparky, no, come over here, this way, watch me. Whatever we're saying, and the eyes and the brain are all over there because that's where the stimulus is. So that can impact things. It can also work against us if we have an animal that is perhaps worried about their handler, but they're using a different strategy, and they're actually using a look away to diffuse that threat. They're using more of an avoidance strategy to try to, we assume, feel more comfortable. So if I'm trying to get this dog to look at me, and this dog is concerned about me and is actively avoiding eye contact with me because they're really concerned, that's a problem. So eye contact and taking direction can absolutely be affected. When we're working with animals and we're using positive reinforcement methods of a variety of types, we're thinking more about those, and here as well, positive emotional states. So the rewards of play and social interaction and food all become relevant. And quite honestly, when you're worried about safety, all of those other things in the moment are kind of a luxury. Play is pretty much irrelevant when you're worried about personal safety. And even if we are trying to reward with food, that actually could be considered a punishment, if you will, if that stressor is put into place in sort of the wrong way. So there's a lot of impacts here. Now, a couple of other ones here as well. If fear and anxiety creates hyperarousal or agitation, that's obviously going to impact the learning response as well. Back to that focus issue. In some cases, it's even a safety issue. Even if this is not an animal who is necessarily aggressive or threatening. Anybody ever work with dogs who develop a really, really hard mouth when they're worried? You can feel it on your fingers when you're giving them food treats. It can be dangerous depending on how hard and how inhibited that mouth or how uninhibited that mouth becomes in that moment. And we can use that as a barometer of our threshold as well. But that's where hyperarousal or agitation comes into play. And avoidance behaviors, whether that animal is shutting down, choosing to do nothing as essentially a way to keep themselves safe, or whether they're developing defensive behavior as a way to control their surroundings. We see all of these avoidance behaviors that start to develop. Now, what I really want to get into, and this is where we're going to spend the rest of our time today, is what does that do to our recommendations? It's one thing to sort of acknowledge all of that and say, yes, this is what fear is, this is what anxiety is, this is what's happening in the brain, and this is how it might be relevant. But what do we do about it? How do we actually modify our recommendations? That's what I'm going to spend the rest of the time on. So, one of the first strategies that I think of when I'm working with my clients and I'm working with an animal where we have fear and anxiety issues is that I do think it's relevant to recognize that fear and anxiety as normal. That's not to say that I think it's always appropriate or that it's acceptable or that we just have to go, oh, it's normal, can't do anything about it, what else are we going to do? No, that's not what I mean when I say normal. I want us to understand that it is a normal process. It is something that is adjustable. It is something that we can work on, but there is a physiologic basis for it. Just because an animal expresses fear or anxiety does not mean that they are automatically, pathologically affected. It may be normal for them. And we can understand for a particular animal where that fear or anxiety might be coming from. Oftentimes with my clients, we spend a lot of time looking at how a particular animal responds. Now, where we're observing that directly in the office, we may set up scenarios where we're seeing how that animal responds. We spend a lot of time getting a detailed history. Clients fill out history forms. We get all of that information to try to figure out how that fear and anxiety is manifesting itself. What are the scenarios that we need to be able to address? Now, for those of you who have done any sort of behavior mod, or you might call it rehabilitation work for an animal with fear or anxiety issues, generally speaking, is this a fast process? Okay, so some of you have some experience. Excellent. Or is it slower? It can be very slow. Now, what does slow mean? Does it mean a weekend? Does it mean 2 weekends? Does it mean a lifetime? Yeah, and it depends. I mean, there are some of our patients that we work with where once we know what to do with them, we have some of these fast responders. And sometimes even in a weekend, we can turn their lives around. That's generally not how it works, but sometimes we're really, really lucky and that can happen. But that's something that I find difficult when I'm meeting with a client for the first time. Because I say, well, how much effort am I going to have to put in this? How long is this going to have to take? How long am I going to be avoiding other dogs on walks? How long is my dog going to be, panicked on the 4th of July? And I pretty much have to shrug my shoulders and say, I don't know. I don't know. What I typically do is figure out where we are to the best of our ability. We put the treatment in that seems most relevant where we are right now, and then we set a reevaluation point. Depending on the animal and how quickly we think they're going to respond, that might be a week from now, it might be a month from now, it might be 6 to 8 weeks from now. But we set a point to reevaluate, either by phone or email or in person. And then we look, where did we start? And where are we now? If we were putting in 3 hours of work a day, and we've gone from this level to here, probably not going to be a fast responder. We're looking at a really long, slow, gradual response. On the other hand, if the person says, gosh, things are way better, but I just haven't had time to work on anything. Like, really? It's way better and you haven't really done anything? That's awesome. Imagine what could happen if you actually did the homework I gave you. So my point in looking at this is when we're either in the midst of it for our own animals or whether we're helping others, we have to support those appropriate interventions. We have to support our clients, our friends, our whoever's they are. Just delete that, roll back in the video, and we'll cut that back now. We need to support everybody in the process, as well as supporting the animal through that process of emotional and behavioral change as well. So a lot of education comes into play. It's a huge part of what we do. So I'm not going to put up the photos, again, of the spider, but this is going to come back to threshold. If I'm working with this dog, and we are working on distractions, like presence of second dog, is this probably a great place to get started with our setup? Probably not. It's probably going to be a bit more than what this dog can handle. Now, might we start maybe up next to that garage there, perhaps? Maybe. What we're really looking for when we're doing desensitization and counter-conditioning work for fear and anxiety issues is we're trying to find that teachable moment. We're trying to work within that stimulus gradient where too far away is irrelevant. If we're all the way up by this house here, perhaps practicing sits or downs or watch me's or U-turns or hand touches or find it or fill in the blank. If we're doing anything there and my patient doesn't even know that the second dog is there, am I actively changing their response pattern to other dogs? Nope. It's a really nice way to practice skills. And we're going to have a dog who can do a great sit and down and watch me and U-turn and find it, and fantastic. But the moment another dog shows up, we're going to be right back to where we started from because we haven't actually changed the emotional response to that stimulus. Now, on the other hand, if I start here and this dog is lunging or barking or is extremely tense or we're getting some of those facial expression changes we saw in those other photos, then that's probably too much. And now the type of learning that's happening is more about avoidance conditioning. All this animal is thinking about is how do I get out of here? How do I feel safe? How do I exhibit some level of control over my surroundings? So we're trying to find this sweet spot, this teachable moment. And body language is how we find it. What I will often do when I'm doing an initial setup is we may gradually approach, and the moment we get any level of recognition, ear flick, eyes, orientation, whatever it is for that particular dog, that's right around the point where their brain is going to start kicking into gear to say, okay, I now know that there's a dog over there. What am I going to do about it? And obviously there's a lot of dogs who don't care. Yep, dog over there, no worries. And we really don't see that observable change in body language or behavior. But when we do, that's where our teachable moment is happening. And we can do a lot of different things within that teachable moment, whether we're practicing very specific commands or whether we are working more on emotional responses. Lots of variability there, that more than what I can get into in this particular slide. But we have to have this awareness of that stimulus gradient during our training exercises. Now, let me ask you this. Is the stimulus gradient for a patient, let's pretend Sparky is the dog that we're working with, is that stimulus gradient going to look the same from one day to the next? No. How about from one environment to the next? How about from one stimulus to the next? No. It doesn't look the same. And for those of you who haven't done a lot of this work yet, or maybe just sort of wrapping your heads around that, I find that to be a really hard one for my new clients to get a hold of. They want to be able to say, okay, I've got Sparky, and we're 20 feet away from that dog over there, and that's where we're going to work. So we put the little coin on the floor, and that's where it happens. And then what happens on day 3 is they show up to that little marker on the floor, and it looks completely different like it did the other day. We're already lunging. We're already barking. Or there's no acknowledgement whatsoever. The stimulus gradient is a moving target. I've experienced that, even for myself. If there's something that makes me worried, depending on how calm I am, depending on whether I've made it to yoga that week, depending on whether I was just stuck in traffic, depending on whether my, cat needs to have expensive dental work. Whatever the case is, where my brain is at is going to affect my stimulus gradient and my tolerance level. So it's a moving target. We have to be aware of that as we go through that. Another strategy that may be relevant is the expectations that we have. Who here in the room has trained what they consider to be a normal dog? A dog who learns quickly, who just sort of does what you've asked them to do, and it just kind of all falls into place and you look like a rock star. And then who had to transition from that appointment or from that working session to another one, where none of those things that I just mentioned are actively happening. And we have an animal who's stressed and is not paying attention, and they're distracted, and we have all of these issues. When we're working with the second one, we probably need to have different expectations than we did for dog number 1. What we're often doing for those, in this case, dogs, is we're setting much, much smaller goals. It doesn't mean that our long-term goals have to be less. We may be able to accomplish that, but we're probably going to have to set smaller milestones. And I think that's really important for a couple of different reasons. Not only does it allow us to set our criteria low enough that that animal can be successful, which is key. If we're setting up training sessions, we want to make sure that the animal is practicing doing it right. So if we're setting small goals, it's going to be easier for that to happen. The other reason I find that's really important to set smaller goals is that if you are the one doing the training, how frustrating is it to do training session after training session where you don't reach your goals? What's going to happen to your motivation? Really, really quickly. And it's going to be really hard to continue doing the work. So recognize that from the beginning. We need to create these reliable responses. We need to be able to set up an animal to have a high rate of reinforcement, trying to create, in many ways, that positive emotional state at behaviors they can be successful at. I shoot for a 90% correct response rate as best we can. If I'm not there, if I'm practicing a particular exercise with an animal and they're only successful 50% of the time, what are they doing the other 50%? They're failing. They're practicing doing it wrong. Now, what I tend to think, if I just think, if I put away all my professional knowledge, I think, well, if I just keep practicing it often enough, eventually they'll get it, right? If I just keep saying sit, 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 or if I just keep setting up those situations for that other dog to walk by us, eventually they're going to put 2 and 2 together. Nope. 50% success, 50% failure. If we are setting them up at that break point, we're probably not going to get much better over time, at least because of this. If we lower our goals, we lower our expectations and set up something that resembles something closer to this, now we're actually practicing doing it right. And we're going to be able to move through those other approximations much more reliably. Does that make sense? It's a big deal. It's one of the things that I see a lot of my clients making mistakes with, and I can't blame them. We all want it to be better. We all want it to be better faster. So we think, well, if I just work here, and I put in the effort, we're going to get there. But it doesn't quite work that way for most of our patients. I also find that when we're navigating training sessions with animals who have fear and anxiety issues, it's often necessary to raise the value of the reinforcer. Now, that might be going from praise to food. It might be going from boring food to less boring food. It might be, for some animals, putting the food away entirely and bringing out the ball. Whatever it is for that animal, the reinforcement has to be reinforcing. And what I mean by that is that if we are tossing a ball for a dog that doesn't care about the ball, is it reinforcement? Nope. If I'm giving cookies to an animal who isn't really motivated by food, is that reinforcement? Probably not. We're trying. It's a great attempt, but it's unlikely to change the animal's behavior because in that moment, that consequence doesn't matter. And so when we are increasing the reinforcement value, this is not something that we do sort of arbitrarily. I don't have a handout in my practice where I say, we start with this food, and then we do this food, and then we do this food, and then we do this food, and then here's where we bring the ball in, and here's where we can brush that cat, and here's where we pet the dog. And nope, every dog's different. If I was creating that list, I would have never put green vegetables on the list of reinforcers for my dog. Because I'm like, okay, no, that's going to be way down, like maybe even below kibble. But broccoli stem, he'll do anything for that. It's amazing. I was like, mini zooks are great. I mean, he likes them. But you give him veggies, and he is doing anything you ask. That would not have made it onto my handout, I tell you that. But there are dogs out there who that's the case. Really relevant for working with animals with fear and anxiety issues, certainly consistency. Now, consistency is not only important for animals with fear and anxiety issues. It's really important across the board. But it's especially relevant here. Because if we have anxiety, especially anxiety, it's so important that that animal knows what to expect. If they behave in the same way, but the consequences or the feedback they get from their environment is different from one day or one moment to the next, it's really hard to know what you're supposed to do. And so I really like to maintain that consistency to the best of our ability. Now, it's not possible. None of us are machines. We're not going to do things exactly the same way every day, but we want to do the best we can to find out. And consistency might be within the handler. So for me, when I'm working with my dog, I'm going to try to use the same cues, the same hand gesture. We're going to practice it with the same expectations. It also matters if we're talking about between handlers. So if my partner is practicing the same exercise, I probably need to tell him what we're working on so he's not winging it on his own or doing his own thing. So we have that consistency so the dog knows exactly what's coming. And that can apply to any one of the cues that we're using so that they don't have to guess. Have any of you ever been in a learning situation where you feel like you're guessing what the right answer is? Yes. How comfortable is that?
Not so much.
Not so much. Yeah. And we do it to our animals all the time. And I'm guilty too. I'm not going to stand up here and say I do this perfectly. These are the things that I'm paying attention to when I'm working with my own animals and my own patients. But what we're really trying to focus on is making sure they don't have to guess. I want to make sure that they know exactly what's expected at those points in time. Now, another thing that I focus on when I'm working with dogs who have fear and anxiety issues is I got to give them time to process. They've got to be able to focus. And this is something that we see not only because clients often repeat themselves with that sit, 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 but for dogs, and I got really good at this when I was working with my Dane who had anxiety issues. And for those of you who have done much work with Danes, the average Dane takes about 3 to 5 seconds to decide to do anything. You add anxiety onto the list, and it's like, oh man, it's like moving through mud. So you get used to just giving the cue, waiting for the wheels to turn, and you can almost see like, okay. Oh, sit. Oh, gotcha. And you have to give them time to do that. Now, is it always going to take 8 seconds, 12 seconds to sit? Not necessarily. But we do want to make sure that we're giving them enough time to process. And this is true even as we're setting up different exercises for dogs that have fear and anxiety issues. They do need to be able to process what's happening around them. If we're working with a dog who is fearful of other dogs, for example, and we are not really ever allowing them to settle into their surroundings and think about what's happening, it might be harder to make progress. And it changes a little bit from one situation to the next. We got to give them that time. They have to be able to process that information. They have to have enough time to habituate to whatever is going on around them. And depending on the dog, especially true of those that have fear and anxiety issues, they need to be able to recover. Have any of you ever been in a situation where your emotional reserves were exceeded? What would your response be if in the moment you start to feel like you're getting back under control, another stressor happens? Are you at full capacity yet? I don't know about you guys, but I'm not. I need that time to be able to say, okay, now what's next? And that time, that recovery period is going to be different from one dog to the next. There are some of our patients, our border collies, our working dogs, the dogs who have that sort of working mindset, they can work for 8 hours straight if you let them. And they may be successful with it. But you add fear and anxiety into that list, it's going to be harder. They do need recovery time. They're going to need processing time. They're going to need to navigate that a little bit differently. Yeah. So, this gets back to the question we were talking about before, about getting the dog to come in through the door. I actually had this happen in my house the other day. My partner was on one side of the gate, trying to get the dog to follow, and he's squeaking and flapping and doing all these cues, and the dog is just sitting about 8 steps away, just sitting, not listening. And so he's like, he was running late for work or something like that, so I said, well, I'll grab him. So I give this little squeak noise, which is one of the cues that I use for him. And he pops up and he comes trotting over, and the second he got through the gate, I marked him with a verbal yes, and we happened to be right next to the treat cupboard. So I reached in and grabbed him a food treat. And he was like, well, that was no fair. You give him food, of course he's gonna listen to you. It's like, well, back to that motivation piece. And if you'd like him to listen to you too, maybe you could do the same thing. But the relevant piece was there. I wasn't sitting there going, come on, buddy, come on. I wasn't trying to bribe him to come in, because then he could look at it and go, well, I'm in the kitchen and good things happen here. You've got one little mini Zook, and I'm going to stay right where I am. If you get 3 mini Zooks, maybe we'll talk. And that's what happens when we start bribing or trying to bring the reward out first. It works right away and we feel like rock stars. We're like, look, he's listening. And then we run into a situation where I put the food away and it's like we've never practiced this a day in our lives. And that's because of the order in which the reward was presented. So my goal is almost never using bribes. And then again, I sort of defined it here by giving food when that's our reinforcer in hopes that the animal will pay attention to us. I may use lures, and I often use a lure where I'm teaching a behavior for the very first time. I may use a food lure that sort of orients or gets them moving in the right direction. But usually, even for my dogs with fear and anxiety issues, even within the first 3 to 5 repetitions, the lure goes away and we immediately go to teaching that as a reward. So the food may still be present, but it's not there before the cue. And that's what allows us to get out of that scenario where, and this is actually a whole other topic, but one of the major objections that a lot of my clients as well have when we talk about using food reinforcement is I want my dog to listen to me for me rather than listening to me for food. Might be semantics, but it's a relevant point. I say if we're bribing, they're just listening to the food. If you teach your dog to listen to you, and we leverage those reinforcers, We're not dependent on the presence of food in order to get the dog to respond. We're just not. If we do it right, it works really well. What I want to do is just wrap up with a couple of things. We talked a bit about this difference between classical and operant conditioning. And this is really not going to go into a lot of detail here, other than just to recognize that there's no one tool that's going to be right for every animal in every circumstance. So if you're doing this either for your own animal or if you're working with a lot of different animals, you have to have more than one tool. You just have to. And you have to be able to get at least a basic understanding of when those individual tools are likely to be a good fit for individual patients. Now, this is an important point that I do want to mention. When we are working on desensitization and counter-conditioning for fears and anxieties, the vast majority of the time, it's kind of boring. Now, it still should be fun. I don't mean to say that we should be truly bored by the process, but it's not about setting dogs up to have these significant reactions so we can talk them back off the ledge again. No, we really want to be practicing, showing them what to do, rewarding them for how to do it correctly. About 90% of the time or better. And if we're doing that, we're hopefully avoiding the lunging and barking episodes. We're avoiding those panic episodes. We're avoiding those reactions that we want to get rid of. We don't have to trigger them. We don't have to put that animal into over-threshold situations in order to address their issues. And that's a really important detail that does take a little bit of practice to get used to. And the side note that I want to mention on this one, this is a common mistake that I see both from pet owners across the board. I see everybody making this mistake. I'm not going to single out any particular group here on this one. Triggering the behavior and then redirecting the dog's focus. So, example, vacuum cleaner. You start the vacuum, dog goes, and I say, come here, sit. Sorry, buddy. I know, it's like we're training up in the front row here, buddy. So I squeak and I call the dog over and I get a nice sit, and then I reward. And I think, yes, I just did a really successful training repetition of teaching my dog what to do when the vacuum cleaner turns on. What I actually just did was I just taught a behavioral sequence. Vacuum on, lunge, bark, orient, sit, cookie. Vacuum on, lunge, bark, orient, sit, cookie. I'm not actually teaching the dog what to do instead. I'm redirecting them after the reaction has occurred, and that will not, generally speaking, get rid of the undesired behavior. Now, in the moment, if I'm walking my dog down the street and he starts lunging because something got his attention, would it be appropriate to redirect him and get his focus back? Absolutely. But what I need to recognize as the trainer is that actually was an oops. We just went over threshold, and that redirecting was all about recovery, but it wasn't a successful training repetition. What I would do is, especially if that were, say, a dog in a fenced yard, I'd say, oops, over threshold, let's get you back in focus. Let's give you time to speak the second language. Let's get your brain back under control. Let's loop back around and let's try this again, but at a lower intensity. So then I can teach you to look at the other dog, look at me without lunging and barking. That's where we're actually strengthening behaviors. Now, one thing that I do want to bring up as we wrap up with the talk today is, we talk a lot about training strategies and management and avoidance and respect and acknowledgement of normalcy, and those are all fantastic and should be a part of every single one of these consultations. With that being said, sometimes they need more. They need different. They need help. And oftentimes that happens in situations where we either can't find, for example, if we're walking a dog in a neighborhood where there are dogs everywhere, and the dog is in a continual hypervigilant state regardless of whether dogs are present or not. Using medications or supplements or nutritional therapy or body work or any sort of complementary strategies to bring arousal level down is absolutely relevant. So if we're trying to find that sub-threshold intensity, we may need extra help. There's more here that I can get into today in terms of when medication's appropriate, and certainly we're not going to talk about which medications are appropriate or how to weigh the benefits of one versus the other. but we do use medications and supplements and nutritional therapy a lot in our practice for patients who have fears and anxieties. It can be an absolute game changer when it's done well. We do not need to create zombies of our pets in order for medication to be helpful. We don't need to create personality changes in order for medication to be useful. There's a right and a wrong way to do a lot of this. And so just know that there are options here as well. Certainly we do those consultations in the practice. We also have the ability to do vet-to-vet consultations. Perhaps if you've got a client or yourself, and for whatever reason coming in isn't a feasible option, we can consult with area vets for specific medication solutions as well. So lots of different opportunities there to aid in this piece so that the work we're doing and everything else is able to be successful. So what I want to do by wrapping up with our time today is really just keeping all of this in mind. What is fear and anxiety? We've covered that. We've looked at some of the brain anatomy and brain function that's relevant here. We've targeted some of the learning and emotion details as well as the impact on training and a lot of strategies and recommendations. I am incredibly grateful for your contributions and some of the examples. It makes a lot of this a whole lot easier for everybody else to understand when we're putting these details into real life scenarios. And with that, this is Cornelius. That's my boy. He's a bull terrier, rat terrier mix. For the record, don't ever do that to yourself. It's not good. It's not good. I adore this dog. He just turned 2, thank God. He's doing great. But with that, I'm going to thank you guys for your time.